The Central Medical Supplies Public Corporation, also known as the CMS, is one of the most deep-rooted corporations engaged in the field of medical supplies in the Sudan. The mission was initiated in the mid-30s in the form of central warehouses of medicines affiliated with the Department of Medical Services. Later, its location was moved to Kilo 5 region of Khartoum South. In 1954, it settled in its current location, that is, the industrial area in Khartoum South. Though it began as a department affiliated with the Federal Ministry of Health, it later became an autonomous corporation under the appellation of the Central Medical Supplies Public Corporation in 1991. The Central Medical Supplies Public Corporation is governed by an administrative board which is nominated by the Council of Ministers. It is concerned with strategic planning and general policy supervising its implementation. The Central Medical Supplies Public Corporation is the national center for procurement, storage, and distribution of medicines and medical devices in Sudan. It caters to both public and private sectors. It is in charge of the administration of the Global Fund to Sudan for AIDS, tuberculosis, and malaria. The range of medical supplies at CMS includes medicines, vaccines, and other biologics, medical consumables, and a wide range of medical devices. The main objective of CMS is the provision of highly needed medical supplies that are of high quality but are of minimal cost to health facilities. It is worth mentioning that the availability of drugs has increased up to 95% in recent years, which is an accepted rate in the industry of medical supply. The increase in availability was associated with the high quality of the drugs, which was accomplished through the commitment of the corporation to import the registered drugs and medicines. This commitment resulted in the rate of the registered drugs increasing to 96%. Consequently, this was reflected on the corporation's drug quality, especially so after the rate of the rejected drugs decreased for reasons related to the quality to less than 0.5%. Pursuant to a decision of His Excellency the President of the Republic for the achievement of a medical security in the country as a strategic objective of the state, CMS has launched a new model for unified supply system of medicines to the state as well as the main public health organizations such as National Health Programs, Military Services, and National Health Insurance Fund. According to the agreement, CMS is responsible for the availability and quality of medicines at health facilities. The state's medical supply fund is also responsible for the distribution of medicines that treat HIV/AIDS, TB, and malaria donated by the Global Fund. Medicines that are dispensed free of charge during the first 24 hours in hospital, and very recently, free medicines project for children under 5 years of age. The Central Medical Supplies Public Corporation undertakes the pricing of the medical drugs and consumables pursuant to what was mentioned in the order of its incorporation, and it observes of the pricing of registered drugs and medicine regulations. There are major developments in transportation of pharmaceuticals and medical devices. CMS transports its medicines from Port Sudan to Khartoum and from its warehouses in Khartoum to customers elsewhere in Sudan. In temperature-controlled vehicles, the receiving and the delivery are made through an outsourced service by Sudapost Sudan Mail Company. As to the field of storage, the corporations succeed in improving the storage environment through the introduction of the electronic monitoring of temperature and humidity in CMS's warehouses, which is one of the requirements of WHO Good Distribution Practice. Likewise, the CMS succeeded in developing the methodology of work in the corporation through the benefiting from the System of Enterprise Resource Planning, also known as ERP, as it launched a database inclusive of all the operations in the corporation. In the technological side, the CMS managed to introduce the electronic supply system, which rendered it the first government corporation in the country to work with the integrated electronic sale, where the system allows the customers to process their orders and pay their invoices online. Likewise, the corporation introduced a new hot telephone line service, 5959, which helps customers to ask queries about the availability of certain medicines. CMS offers its customers the option of importing the requested items, if it is not available in Sudan, from neighboring countries within 72 hours at cost without charging any additional fees. The remarkable record of achievements which were attained by the CMS is due to the high efficiency of its employees and its keenness to provide them with the continuous and effective training inside and outside the country, which positively reflected on as the improvement of the work. In recognition of the importance of training, the CMS established a specialized training center to train the employees and partners of the corporation and the pharmacists in both the public and private sectors. The Central Medical Supplies Public Corporation, CMS, is proceeding on such firms' paces towards its hoped-for ends in the attainment of the highest rates of excellence after it had been able to realize remarkable achievement on all planes during a short period. Based on a wide and extensive performance of a qualified staff, an attractive work environment, sound planning, and a distinguished administration. All these factors rendered the corporation with its management and employees as a bright, homogeneous team who spare no effort in the realization of its exalted objectives. Such accelerated paces of success predict that the corporation is steadily proceeding towards a bright future, brimful of the successes which will set the country at the forefront of its counterparts, of the states of the region in the field of pharmaceutical supply.